everybody. Welcome to the program. Are you a caregiver, maybe for a loved one or a dear friend? Well, then your days are probably pretty busy. But do you take time for yourself? That's extremely important. We're going to be talking about why it's so important today in this segment on Community Health Matters. I want to welcome to the program Jennifer Abernathy, who is the Executive Director for the Tennessee Respite Coalition. We're so glad to have you, Jennifer, on the program.
Thank you so much for having me.
You know, I need to share a statistic too, folks, real quick. It says, according to the 2015 study in caregiving in the U.S., nearly 44 million adults in the U.S. are providing caregiving for a loved one. If you can let people know what caregiving actually is, please.
Yeah. Well, there's lots of different forms of caregiving. With the Tennessee Respite Coalition, we consider a caregiver someone that's living in the same home of the person that they're caring for.
Okay.
And this can be somebody that is of any age, have any disability, as well as, you know, just an aging senior that may not be, you know, able to move around as well as they could in their own home.
Sure.
But then they're also nationally, you know, talking about resources for distance caregiving, because a lot of parents, aging parents, do not live in the same city as their adult children. And so those adult children are kind of doing the distance caregiving and trying to coordinate resources for people as well. So it's, you know, there's different levels to think about when caregiving.
And with technology, obviously, that makes it somewhat easier, but still.
Definitely. There's wonderful different technologies out there for people to kind of keep track and, you know, and understand what their family members are doing if they're not in the home with them. But the caregivers that are in the home all the time, a 24/7, you know, responsibility for their loved one, it can be very draining.
Yes, it can. And even though technology helps with the long distance, there are some daily challenges that a lot of these caregivers face. Can you give us an idea of some of the things that people might not even really recognize as a challenge?
Oh yeah, definitely. The one example is a call that we just received not too long ago of a parent who is caring for a child with a disability who doesn't sleep. Doesn't sleep at night, can't sleep through the night. So the challenge for that parent is to get an uninterrupted period of rest for themselves, which is, you know, of course you're doing that, you know, when you have a new child and, you know, and everything. But for some parents that have a child with a disability, they, that's their life in entirety, and it's not going to end. So, you know, so when you think about that, a nap can be challenging for caregivers.
Absolutely. Absolutely. That's a great example. We've heard, a lot of people have probably heard the expression, you know, caring for the caregiver, but for people who haven't, explain what that means, please.
Yeah, caring for the caregiver is really services and actually a lot of self-care for the caregiver. Respite is the gift of time for family caregivers, and it's the time to take care of yourself. So we try and ensure that people have that time to take care of themselves and get those things done and make those social connections that they don't have time to do when they're caregiving.
If you don't mind, and not that we want to talk too much about negative things, but at the same time, it's realistic to talk about consequences for a caregiver if they don't have this support, if they don't have this time for themselves. What can happen over time for somebody who's not making those, you know, whether it be 20 minutes here or an hour here from time to time out of their day, carving out that time for themselves? What can happen down the road?
Well, you know, as we all know, people that do too much and don't take breaks, this is for everybody, you know, that you burn yourself out. And caregivers can burn themselves out very quickly because they're trying to balance their work, their social life, and caring for their loved one. So, so burnout is huge, and if they're not taking the time to take care of themselves by going to the doctor, they can also have, you know, health ramifications. They can, you know, if they have diabetes or some kind of chronic illness themselves, they tend to ignore that, and then those chronic illnesses wind up taking, you know,
taking them kind of out of the situation. And
exactly. Yes, and then you're not able to actually care for the loved one because you're too sick. It's kind of like, in a lot of respite people nationally use this analogy, is putting on when you're on a plane and they talk about putting on the air mask,
yes,
when they talk about putting on the air mask yourself first and then
assist
the other one, that's kind of what, you know, caregivers need to do, is talk, you know, is take care of yourself, because then you can take care of somebody else.
Absolutely. All right, you mentioned what respite is, kind of the gift of time.
Yes.
Elaborate a little bit more on that. Give people some examples of what exactly that means.
Yeah, yeah. Well, and respite can be what the caregiver needs at the time. Respite is the time. You know, it's not a service. It's not, you know, that's just the word we use for the time. So we've had families that the coalition has helped that have used respite time to go on a weekend vacation, to be able to renew their vows on a beach. We have an individual who's using their respite time to have after-school care for her daughter so that she can continue working and not have to leave work early. And then there's people that use respite time to take an uninterrupted nap. That is so key, you know, to take care of yourself. And then also continuing with social connections and ensuring that, you know, that they have, caregivers are individuals, and a lot of times they lose that sense of self, and so respite can be used for making those connections and continuing those connections in the community.
For folks who don't have extended family, Jennifer, in their area, and they need some respite time, that caregiver does, what would you folks recommend to them in terms of trying to bring in somebody who could help out and help take care of their loved one?
Definitely. Well, you can always call the Tennessee Respite Coalition. We do have a helpline that's able to, you know, help guide people through. But we also talk to people about finding the natural networks that they don't normally think of. Even if you don't have family in the area, you may have a church family, you may have a social family, you may have neighbors that you're very close to. And there's one kind of trick that I tell family caregivers about, is if you have things that you need done, or you want somebody to come over for an afternoon, think about those ahead of time, make the plan, and then you could put it in a fishbowl beside your door, and anybody that comes to visit, you could just have them pick something out of the fishbowl, and that would be what they can do to help you that day.
Sure.
Because when people ask, you know, and say, "Oh, just call me if you need anything," you either forget to call, you don't know exactly what to ask them, and you just create that little fishbowl, and it solves a lot of problems.
That is such a good idea. You know, we were sharing right before the program, I was talking to Jennifer about a personal situation with my mom and dad, because my mom's my dad's caregiver. It was interesting when I talked to you about the fact that sometimes she'll go to water aerobics or whatnot, and that's her respite time. So even small times out of the day can be refreshing and revigorating for that, you know, that caregiver.
Exactly, exactly. Even the, you know, if their loved one that they're caring for is sleeping, taking time to journal is a very nice way to get some respite, and it's also, you know, a kind of improving mental health kind of thing. Gardening, I know caregivers do exercise and walking when they have respite time, so anything like that. And it's important that caregivers have choice in what they do with that time, because not everybody likes to garden.
Absolutely. So it's got to be something specifically for their needs and their wants and desires. So Jennifer Abernathy, thank you so much for your time today. A lot to consider and great information.
Well,
thank you.
Thank you.